Godfrey, it's J-Boy.
A familiar voice telling a special story is therapeutic for coma patients with a traumatic brain injury, according to a new study from scientists at Northwestern Medicine and Hines VA Hospital.
We have definitive evidence to answer the age-old question. If your mom talks to you in a coma, can you hear her, and does it have an effect? And the answer is yes.
Neuroscientist Teresa Pape and her team enrolled 15 coma patients in a double-blind study that required loved ones to record stories from the past onto a CD. The stories were played for the patients over headphones.
So the patient would listen to these stories 4 times a day for 10-minute increments. So each time they were listening, it just took 10 minutes, and then they would do that for 6 weeks. 7 days a week.
Corinth Katanis' husband, Godfrey, suffered a brain injury while being treated for a blood clot and was in a coma for months. She volunteered to enroll him in the study and recorded a story about their wedding day.
After we got engaged, I remember how I would tease you about our first kiss. I would tell you that I would just give you a peck on the cheek on the altar, and then you would frown in reaction.
Godfrey's brain lit up when he heard his wife's voice. The scientists captured the response on MRI images. The stories helped awaken Godfrey from his vegetative state, the scientists say.
We saw an improvement in arousal and awareness.
Research study really was so important to where he was and bringing him to where he is today.
Today, Godfrey is cognitively intact and can type and communicate through an iPad.
It was kind of comforting to think that they were there with me.
The techniques used in this study require little technology and no drug therapy. Pape says loved ones of coma patients should give it a try.
Take the photo albums in, spark the conversations, start talking about these memories that the patient will respond to. And you may not see it right away at the behavioral level, but it's having an effect.